Welcome to the Health Insider. Before we get started, I need to ask you something. Have you ever felt a sudden headache that came out of nowhere and then just disappeared? Or maybe you noticed your vision got a little blurry for a few seconds and then everything was fine again? Most people shake it off. They say, "I'm probably just tired," or "I didn't drink enough water today," and they move on with their day. But here's what nobody tells you. Those few seconds could be your brain sending out a distress signal, and ignoring it could cost you everything. Every single year, nearly 800,000 Americans suffer a stroke. That's one person every 40 seconds. And the most heartbreaking part? A large number of those strokes were preventable. The warning signs were there. They just didn't know what to look for. Or they noticed something, but told themselves it was nothing serious. Here's what makes strokes so dangerous. They don't always come with a dramatic collapse or a sudden blackout. Sometimes the warning signs are so quiet, so easy to brush off, that people miss them completely. And by the time they realize something is very wrong, precious time has already been lost. Because with a stroke, every single minute matters. Doctors say that for every minute a stroke goes untreated, nearly 2 million brain cells die. 2 million per minute. Now here's the belief I want to break right now because it's dangerous and it's extremely common. Most people think strokes only happen to the elderly. They picture an 80-year-old man suddenly falling over, but that's not the reality anymore. Strokes are rising sharply among people in their 40s and 50s. Some are even happening in people in their 30s. High blood pressure, poor diet, stress, lack of sleep. These things are affecting younger people at alarming rates. And if you think, this won't happen to me because I'm not old enough, that mindset might actually be what puts you at risk. So in this video, I'm going to walk you through the 5 stroke warning signs that most people completely ignore. The ones that seem minor on the surface, but could be your body screaming for help. And I have to tell you, the 5th one on this list is one that almost nobody connects to a stroke. It surprises people every time. So make sure you stay with me until the end. But before we dive in, I want to ask you something. Drop a comment below and tell me, have you or someone you love ever experienced any sudden, unexplained symptoms that came and went quickly? Something that felt odd, but you let it pass? Write it in the comments. You might just realize something important today. Now let's talk about what's actually happening inside your body during a stroke. Because once you understand this, these warning signs are going to make a lot more sense. Think of your brain like a city that runs on electricity. The roads in that city are your blood vessels, and the electricity is the oxygen and nutrients your blood carries. Your brain needs a constant, uninterrupted supply of that oxygen to function, every second of every day. A stroke happens when one of those roads gets blocked or bursts. The electricity cuts off, and the part of the city that road was feeding starts to go dark. Depending on which road is affected, different functions of your body start to fail. Your speech, your vision, your ability to move, your sense of balance. That's why the symptoms can look so different from person to person, and that's also why they can be so easy to miss when they're mild. Number 1. Sudden numbness or weakness on one side of your body. This one sounds obvious, but here's why people miss it. The numbness or weakness is usually one-sided. It might just be your face drooping slightly on one side, or your arm feeling a little heavy and hard to lift, or your leg feeling like it has less strength than usual when you take a step. People often think they slept on it wrong. They shake their arm out and think it'll pass. But here's the key thing. If you notice weakness or numbness that appears suddenly and is specifically on one side of your body, that is not muscle stiffness. That is your brain sending a signal that something is cutting off blood flow to the part that controls that side of your body. The brain controls opposite sides. Your left brain controls your right side, and your right brain controls your left side. So one-sided symptoms are a direct clue. The practical tip here is simple. If you or someone near you suddenly has drooping on one side of their face, can't raise one arm properly, or has unusual numbness on one side, call emergency services immediately. Don't wait to see if it gets better. Number 2, sudden confusion or trouble understanding what people are saying. Imagine you're in the middle of a perfectly normal conversation and suddenly the words coming at you just stop making sense. Or you open your mouth to say something simple, and what comes out is scrambled or slurred. This is one of the most chilling warning signs of a stroke, and yet people explain it away constantly. They say they're tired, they say their mind went blank for a second, they laugh it off. But sudden confusion, especially when it comes out of nowhere and feels different from just being distracted, is your brain under attack. The language centers of the brain are incredibly sensitive to disruption. Even a brief interruption in blood flow can cause a person to temporarily lose the ability to speak clearly or understand language. If this happens and then passes quickly, many people never even mention it to a doctor. But that passing episode? It has a name. It's called a transient ischemic attack, a TIA, and it is often a preview of a full stroke that could come within hours or days. Please don't ignore it. Number 3. Sudden vision problems in one or both eyes. This one is tricky because our eyes blink, we get tired, screens strain our vision, so when something seems off visually for a moment, we rarely think stroke. But here's the difference. Stroke-related vision problems are sudden. They're not the gradual blur you get after staring at a screen for hours. They might look like a dark curtain falling across part of your vision, or double vision that appears out of nowhere, or a sudden loss of vision in one eye that then comes back. Think of it like a power flicker in your city. When the blood flow to the visual processing parts of your brain gets disrupted, even briefly, the lights flicker. And that flicker can look like sudden, unexplained changes in what you see. If your vision suddenly changes in a way that feels unusual and rapid, even if it passes, that's your signal to get checked immediately. Don't wait. Number 4. Sudden, severe headache with no known cause. Doctors sometimes call this the thunderclap headache. And the name says it all. This is not a tension headache building slowly behind your eyes. This is not a migraine that crept up on you. This is a headache that hits you like a thunderbolt, the worst pain of your life, arriving in seconds with no warning. This type of headache can be a sign of a hemorrhagic stroke, where a blood vessel in the brain has burst. The pain is caused by blood irritating the surrounding brain tissue. Now, not every severe headache is a stroke. But if you or someone you know ever says the words, "This is the worst headache of my life," and it came on suddenly, that is a medical emergency. Call 911 right away. Every second matters. If any of this is making sense to you, and you feel like this is information that could genuinely help someone, go ahead and hit the like button right now. This kind of awareness is what saves lives, and sharing this video could be the most important thing you do today. And be honest with yourself as you're watching this. Have you noticed any of these things and not thought twice about them? Number 5, and this is the one that surprises people the most: sudden trouble walking, loss of balance, or unexplained dizziness. Most people associate dizziness with dehydration, low blood sugar, or standing up too fast. And yes, those things can cause it. But here's the question. Was it sudden? Was it different from anything you've felt before? Did it come along with any other strange symptoms, even mild ones? The cerebellum is the part of your brain that controls your balance and coordination. When blood flow to that region is disrupted, you might suddenly feel like the ground is moving under you. You might stumble for no reason. You might feel an overwhelming sense that something is off with how your body is moving through space. A lot of people who experience this symptom alone sit down and wait for it to pass. And sometimes it does pass, but combined with even one other symptom on this list, a sudden headache, a moment of blurry vision, one-sided weakness, this becomes a crisis requiring immediate action. Here's the bigger picture I want you to take away from this video. We've been taught to power through discomfort, to not overreact, to not bother the doctor unless something is really wrong. And that mindset, as well-intentioned as it is, can be deadly when it comes to strokes. The truth is this: the warning signs of a stroke are often the body's last polite attempt to get your attention before something catastrophic happens. A TIA, a mini-stroke, is not something to sleep off. It's an emergency. It might pass in minutes, but the window to intervene to prevent a full stroke is narrow, and acting immediately is what keeps people alive and functional. So what do you actually do with this information? Here's your simple, clear action plan. First, memorize the word FAST. It stands for face drooping, arm weakness, speech difficulty, and time to call 911. This acronym was created by neurologists specifically so that anyone, not just doctors, can recognize a stroke in seconds. Second, if you notice any sudden, unexplained symptom, even if it passes, tell your doctor within 24 hours. Don't wait for your next regular checkup. Third, know your risk factors. High blood pressure is the #1 risk factor for stroke. Get it checked regularly. If it's high, work with your doctor to bring it down. Smoking, diabetes, obesity, and atrial fibrillation also significantly raise your risk. Fourth, if you're with someone who shows these signs, don't let them convince you it's nothing. Note the time the symptoms started. Doctors need this information to determine treatment options. And fifth, call 911, not a family member, not a rideshare. Emergency responders can begin treatment en route and alert the hospital so the team is ready when you arrive. Let me tell you about a woman named Carol. She was 54 years old, healthy by most measures, active, not overweight. One afternoon she was cooking dinner and she noticed her left hand felt strange, like it had fallen asleep, but she hadn't been leaning on it. Then for about 30 seconds the words on the recipe card in front of her stopped making sense. She read them over and over and they just looked like symbols. Then it passed. She felt fine. She finished cooking, sat down for dinner with her husband, and didn't mention it until the next morning. Her husband, thankfully, insisted she see a doctor that day. Scans revealed she had experienced a transient ischemic attack, a mini stroke. A small clot had briefly blocked blood flow to her brain. Because she got checked within 24 hours, doctors were able to put her on medication and a management plan immediately. 6 weeks later, she told her doctor she believed that one morning of being taken seriously had saved her life. She was right. Let's bring it all together. The 5 stroke warning signs most people ignore are sudden numbness or weakness on one side of the body, sudden confusion or trouble speaking and understanding, sudden vision problems in one or both eyes, a sudden and severe headache unlike anything you've felt before, and sudden trouble with balance, coordination, or walking. Any one of these symptoms, appearing suddenly and without a clear cause, is reason enough to act immediately. You don't need to have all 5. You don't need to be sure. When it comes to a stroke, it is always better to be wrong and safe than right and too late. I want to hear from you now. In the comments below, tell me, did any of these warning signs catch you off guard? Had you ever experienced one and not connected it to stroke risk? Your comment might help someone else recognize what they've been ignoring. And if this video gave you real, useful information, please hit the like button. It genuinely helps more people find this content and could help save someone's life. And if you're not subscribed to the Health Insider yet, now is the time. Every week we bring you clear, honest, science-backed health information that your doctor doesn't always have time to explain. Click subscribe and hit the bell so you never miss a video. And next, I want you to watch our video on the one blood pressure habit that most people do completely wrong every single morning. It directly connects to stroke risk, and what we found surprised even us. You'll want to see that one. One last thing before you go. This video is for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you believe you or someone near you is experiencing a stroke right now, call 911 immediately. Do not wait. And for any personal health concerns, always speak with a qualified healthcare provider who knows your individual situation. Stay informed, stay safe, and we'll see you in the next video.